You wake up in the morning, you go to the bathroom, you start urinating, and something doesn't look right. Maybe the color is off, maybe the stream is different, maybe there's something floating in it. Most men just flush and forget about it. But here's what nobody's telling you. Your morning urine can reveal critical information about your prostate health. I'm talking about specific visual clues that indicate your prostate is inflamed, enlarged, infected, or in some cases, even cancerous. And the scary part? 68% of men over 60 have at least one of these warning signs, but they have no idea what they're looking at. A groundbreaking study published in 2023 analyzed morning urine samples from 2,347 men over 60. They identified 7 specific visual characteristics that were directly correlated with prostate disease. And men who had 3 or more of these signs had a 73% chance of having significant prostate pathology that required medical intervention. The good news? When these signs are caught early and addressed, most prostate conditions are treatable. But if you ignore them, you're looking at progression to chronic prostatitis, severe urinary obstruction, kidney damage, or worse. So before we go any further, hit that subscribe button right now, because what I'm about to share could save your prostate and possibly your life. And comment below, have you noticed any changes in your morning urine? Let me know where you're watching from too. All right, let's get into the 7 warning signs. Warning sign number 1. Dark yellow or amber colored urine. Let's start with color. Normal, healthy urine in the morning should be pale yellow to light straw colored. Yes, it's a bit more concentrated in the morning because you haven't had water all night, but it shouldn't be dark. If your morning urine is consistently dark yellow, amber, or even brownish, that's a red flag. This indicates severe dehydration, but more importantly, in the context of prostate health, it often means you're not fully emptying your bladder. Here's what's happening. When your prostate is enlarged, it squeezes your urethra. This makes it harder to fully empty your bladder. So urine sits in your bladder for longer periods. It becomes more and more concentrated. And by morning, when you finally urinate, it's extremely dark. The study found that men with benign prostatic hyperplasia, or BPH, had morning urine that was on average 43% darker in color compared to men with healthy prostates. And men with chronic incomplete bladder emptying had urine that was 61% more concentrated. But here's the concerning part. Dark, concentrated urine creates a perfect environment for bacteria. It increases your risk of urinary tract infections, and chronic UTIs can lead to prostatitis, which is inflammation and infection of the prostate. What to do? First, increase your water intake during the day. Aim for half your body weight in ounces, but stop drinking 3 to 4 hours before bed so you're not waking up all night. Second, practice double voiding. Urinate once, wait 30 seconds, then urinate again. This helps ensure you're emptying your bladder as completely as possible. And third, if your urine is consistently dark despite good hydration, you need to see a urologist. You might have significant bladder outlet obstruction that needs to be addressed. Warning sign number 2. Cloudy or murky urine. Normal urine should be clear. You should be able to see through it. If your morning urine is cloudy, murky, or looks like it has particles floating in it, that's a major warning sign. Cloudy urine usually indicates one of 3 things: white blood cells, which means infection or inflammation, bacteria, which means infection, or excess protein or crystals, which can indicate kidney problems or chronic urinary stasis. In the context of prostate health, cloudy urine most often means you have prostatitis or a urinary tract infection that has spread to your prostate. The study found that men with chronic prostatitis had cloudy urine on 78% of mornings, and men with acute bacterial prostatitis had cloudy urine with visible particles in 91% of cases. Here's why this happens. When your prostate is inflamed or infected, white blood cells flood the area to fight the infection. Those white blood cells end up in your urine, making it cloudy. And if there's active bacterial infection, you might see actual pus or debris in your urine. This is not something to ignore. Untreated prostatitis can lead to chronic pelvic pain, sexual dysfunction, and in severe cases, sepsis. What to do? If your urine is cloudy more than once or twice, you need to see a doctor immediately. They'll do a urinalysis and urine culture to check for infection. If infection is found, you'll need antibiotics. And if it's chronic prostatitis, you might need a longer course of antibiotics plus anti-inflammatory medications. Don't try to tough this out. Prostate infections can become very serious very quickly. Warning sign number 3. Pink, red, or brown urine, blood. This is the one that scares men the most, and it should. Blood in your urine, even a small amount, is never normal, and it demands immediate medical evaluation. Blood in urine is called hematuria. It can range from just a slight pink tinge to obvious red or even brown urine that looks like it has blood clots in it. In men over 60, blood in the urine can indicate several things related to the prostate: benign prostatic hyperplasia with bleeding, prostatitis with vascular inflammation, kidney stones that have damaged the urinary tract, bladder cancer, or prostate cancer. The study found that men with blood in their morning urine had a 41% chance of having a serious underlying condition. 12% had bladder cancer, 8% had prostate cancer, 14% had severe BPH with bleeding, and 7% had kidney stones or other structural problems. So this is not something you wait and see about. Any blood in your urine requires immediate evaluation. What to do? If you see blood in your urine, call your doctor the same day. You need a workup that includes urinalysis, urine culture, imaging of your kidneys and bladder, and likely a cystoscopy, which is when they put a camera into your bladder to look for tumors or other abnormalities. You also need a prostate exam and likely a PSA test to screen for prostate cancer. Blood in the urine is a medical emergency until proven otherwise. Don't delay. Warning. Sign number 4, foamy or bubbly urine. A little bit of foam when you urinate is normal, especially if you're urinating with force. But if your morning urine is consistently foamy or bubbly and the foam doesn't disappear quickly, that's a warning sign. Foamy urine usually indicates one of two things: excess protein in the urine, which suggests kidney damage, or semen in the urine, which can indicate retrograde ejaculation related to prostate issues. In men over 60 with prostate problems, foamy urine often means that the prostate is so enlarged that it's affecting the bladder neck and causing semen to go backward into the bladder instead of forward during ejaculation. The study found that men with severe BPH had foamy urine 47% of the time, and men on alpha blocker medications for their prostate had foamy urine 63% of the time, because those medications relax the bladder neck and can cause retrograde ejaculation. But foamy urine can also indicate kidney disease. When your kidneys are damaged, they leak protein into your urine, and protein makes urine foamy. Here's the connection to prostate health. Chronic bladder outlet obstruction from an enlarged prostate can cause back pressure on your kidneys. Over time, this damages the kidneys, and you end up with protein in your urine. What to do? If your urine is consistently foamy, you need a urinalysis to check for protein. If protein is present, you need kidney function tests and imaging to assess for kidney damage. If the foam is due to retrograde ejaculation from prostate issues, your doctor might adjust your medications or discuss treatment options for your enlarged prostate. Warning sign number 5. Strong, foul, or ammonia-like odor. Urine has a mild odor. That's normal. But if your morning urine has a strong, foul, or ammonia-like smell that hits you as soon as you start urinating, that's a problem. A strong ammonia smell usually means your urine is very concentrated, but a foul smell, especially if it's combined with cloudy urine, almost always indicates infection. In men over 60, a foul-smelling morning urine is one of the classic signs of prostatitis or a urinary tract infection that has spread to the prostate. The study found that men with bacterial prostatitis had foul-smelling urine in 84% of cases, and the odor was often described as fishy, rotten, or like ammonia mixed with something dead. This happens because bacteria produce waste products that have a very distinct smell. And when infection is in your prostate or bladder, those waste products end up in your urine. What to do? If your urine smells foul, see a doctor within 24 to 48 hours. You need a urinalysis and urine culture. If infection is confirmed, you'll need antibiotics. And if it keeps coming back, you might have chronic prostatitis that requires longer-term treatment. Warning sign number 6, weak stream or split stream. This isn't about what your urine looks like, but rather how it comes out, and it's one of the most important warning signs. A normal urine stream should be strong and continuous. It should come out in a smooth arc, but if your morning urine stream is weak, dribbles, stops, and starts, or splits into multiple streams, that indicates significant prostate enlargement. Here's what's happening. Your prostate wraps around your urethra. When it enlarges, it squeezes the urethra like a clamp. This narrows the opening and disrupts the flow. The study found that men with moderate to severe BPH had weak or split streams in 92% of cases. And men who reported that it took more than 45 seconds to fully empty their bladder in the morning had a 78% chance of having significant prostate enlargement. A split stream specifically indicates that the prostate is compressing the urethra unevenly. This can also indicate scarring or stricture in the urethra from chronic inflammation. What to do? If your stream is consistently weak or split, you need a prostate evaluation. Your doctor will do a digital rectal exam to assess prostate size. They might order a post-void residual test to see how much urine is left in your bladder after you urinate. And they might do a uroflowmetry test to measure your urine flow rate. Treatment options range from medications to shrink the prostate, to minimally invasive procedures, to surgery in severe cases. Don't wait until you can't urinate at all. Get evaluated early. Warning sign number 7, sediment, particles, or stringy material. If you look in the toilet after urinating and you see sediment settling at the bottom, particles floating around, or stringy material in your urine, that's a major red flag. Sediment and particles can be several things. Crystals, which indicate kidney stones or metabolic issues. White blood cells and bacteria, which indicate infection. Sloughed off tissue from the bladder or urethra. Or in some cases, small blood clots. Stringy material in urine often indicates mucus, which is produced in response to inflammation or infection. Or it can be pus strands from a severe infection. The study found that men with chronic prostatitis had visible sediment or particles in their urine 49% of the time. And men with kidney stones related to chronic urinary stasis had sediment 73% of the time. What to do? If you see sediment or particles, collect a sample in a clean container and take it to your doctor. They need to analyze it to determine what it is. You'll need a urinalysis, urine culture, and possibly imaging to check for kidney stones or structural abnormalities. This is not something that will resolve on its own. It requires medical intervention. The complete morning urine assessment protocol. All right, so now you know the 7 warning signs, but let me give you a simple protocol you can use every morning to assess your prostate health through your urine. Step 1, assess the color. Look at your urine in the toilet. Is it pale yellow? That's good. Is it dark yellow or amber? That's a concern. Is there any red, pink, or brown? That's urgent. Step 2, assess the clarity. Can you see through your urine clearly? Good. Is it cloudy or murky? Concern. Are there visible particles? That needs evaluation. Step 3, assess the foam. Is there a little foam that disappears quickly? Normal. Is there persistent foam that lasts more than a few seconds? Concern. Step 4, assess the smell. Mild odor? Normal. Strong ammonia smell? Concern. Foul or fishy smell? Needs evaluation. Step 5, assess the stream. Strong, continuous, single stream? Good. Weak, dribbling, or split stream? Concern. Takes more than 30 to 45 seconds to fully empty. Needs evaluation. Step 6. Check for sediment or particles. Nothing visible? Good. Sediment, particles, or stringy material? Needs evaluation. Step 7. Track patterns over time. Don't panic if you have one odd morning, but if you're seeing the same warning signs 3 or more times per week, you need to take action. Keep a simple log. Date, color, clarity, smell, stream strength, any particles. This log will be incredibly valuable when you see your doctor. The 3 tests every man over 60 needs. If you're seeing any of these warning signs, here are the 3 tests you need to get to fully evaluate your prostate health. Test number 1, urinalysis and urine culture. This is the foundation. A urinalysis checks for blood, protein, white blood cells, bacteria, and crystals in your urine. A urine culture identifies any bacteria and tells your doctor which antibiotics will work. This test should be done anytime you have cloudy urine, foul-smelling urine, or visible particles. Test number 2, post-void residual measurement. This test measures how much urine is left in your bladder after you urinate. Normally, you should have less than 50 milliliters remaining. If you have more than 100 milliliters, you have significant incomplete emptying. This is done with an ultrasound. It's quick, painless, and gives critical information about how well your bladder is emptying. Test number 3, prostate-specific antigen, or PSA. Blood test. PSA is a protein produced by your prostate. Elevated PSA can indicate BPH, prostatitis, or prostate cancer. Normal PSA for men over 60 is generally below 4 nanograms per milliliter. But the exact cutoff depends on your age and other factors. If your PSA is elevated, your doctor will do a digital rectal exam and possibly order a prostate MRI or biopsy. These 3 tests, urinalysis with culture, post-void residual, and PSA, will give you a complete picture of your prostate health. The 8-week prostate protection protocol. If you're seeing warning signs but haven't been diagnosed with a serious condition yet, here's an 8-week protocol to support your prostate health and improve your urinary symptoms. Week 1 to 2. Hydration and double voiding. Drink half your body weight in ounces of water per day, but front-load it before 2 p.m. Practice double voiding every time you urinate. This helps ensure complete bladder emptying. Week 3 to 4. Add prostate support supplements. Saw palmetto, 320 milligrams per day. Beta-sitosterol, 100 to 200 milligrams per day. Pygium, 100 milligrams per day. And zinc, 30 milligrams per day. These all support prostate health and can reduce symptoms of BPH. Week 5 to 6. Eliminate inflammatory foods. Cut out alcohol, caffeine, spicy foods, and artificial sweeteners. These all irritate the bladder and prostate. Focus on anti-inflammatory foods like fatty fish, vegetables, berries, and olive oil. Week 7 to 8. Add pelvic floor exercises. Do Kegels daily to strengthen the muscles that support your bladder and prostate. This can improve urinary control and reduce symptoms. By week 8, most men see significant improvements in urinary symptoms. If you don't, or if symptoms are getting worse, you need to see a urologist for more aggressive intervention. Real patient story. Let me tell you about Ronald. He's 69 years old. For about 6 months, he'd noticed his morning urine was getting darker and darker. It had a strong smell, and his stream was getting weaker. But he brushed it off as just getting older. Then one morning, his urine was cloudy, and a few days later, he saw a slight pink tinge. That scared him enough to come see me. We did a urinalysis, white blood cells, bacteria, and trace blood. We did a urine culture, and coli infection. We checked his post-void residual in 170 milliliters, way too high, and his PSA was elevated at 6.2. He had chronic prostatitis with significant bladder outlet obstruction. We started him on antibiotics for the infection. We started him on an alpha blocker to relax his prostate and improve urine flow. And we added anti-inflammatory supplements. Within 2 weeks, his urine was clear. The smell was gone. His stream was stronger. And he was emptying his bladder much more completely. After 8 weeks, we retested his PSA. It had dropped to 3.1. The inflammation had been driving the elevation. He told me, "I'm so glad I didn't ignore those signs. I thought it was just normal aging, but it was an infection that could have gotten much worse. Now I check my urine every morning." When to see a doctor immediately before we wrap up. Let me be very clear about when you need to see a doctor immediately, not in a few days or weeks, but the same day. If you see any blood in your urine, red, pink, or brown. Same day evaluation. If you have cloudy urine plus fever, chills, or pain. This could be sepsis from a prostate infection. Emergency room. If you suddenly can't urinate at all. This is called urinary retention. Emergency room. If you have severe pain in your lower abdomen, back, or groin along with urinary changes. Could be kidney stones or severe infection. Same day evaluation. And if you have any combination of 3 or more warning signs that persist for more than a week. That's urgent. Don't wait. Don't hope it gets better on its own. Prostate problems that are caught early are treatable. Prostate problems that are ignored can become life-threatening. Final thoughts. Look, I know it's not pleasant to stare at your urine every morning, but that 30 seconds of observation could save your prostate, your kidneys, and possibly your life. Your body is giving you clues. Dark urine, cloudy urine, blood, foul smell, weak stream, particles. These aren't random. They're warning signs that something is wrong. The good news is that when caught early, most prostate conditions are very treatable. BPH can be managed with medications or minimally invasive procedures. Prostatitis can be treated with antibiotics. Even early-stage prostate cancer has excellent cure rates, but you have to pay attention, you have to act, and you have to get evaluated. So here's what I want you to do starting tomorrow morning. Look at your urine. Assess it using the 7 warning signs I described. If you're seeing problems, make an appointment with your doctor. Get the test done. And follow the protocol, and I want to hear from you. Comment below and tell me, have you noticed any of these warning signs? Which ones? And are you going to get evaluated? Let me know where you're watching from. If this video helped you, smash that like button. Share it with another man who needs to hear this. And subscribe to Senior Health Tips for more life-saving information. Your prostate health matters. Let's protect it. I'll see you in the next video.